Hello everyone. Today in this video lecture of ophthalmology, we are going to discuss about a very important 5-marker questions in the university exam, that is sympathetic ophthalmitis. Okay, from this name we can predict what exactly is this topic about, that is ophthalmitis related to something inflammation inside the eye. Yes, in this lecture we are going to deal about definition of sympathetic ophthalmitis, what is the incidence of this disease, etiopathogenesis, pathology involved in this disease, clinical features, and finally the treatment part and the prognosis part. Okay, let's begin with a discussion on sympathetic ophthalmitis. Okay, first we have to define what exactly is sympathetic ophthalmitis. It is a very serious bilateral granulomatous panuveitis which occurs following the penetrating injury to the eye. Yes, I'll repeat what exactly the definition of sympathetic ophthalmitis. Sympathetic ophthalmitis is a serious bilateral panuveitis condition of the eye following the penetrating injury to the eye. Hope so everyone has got what exactly the sympathetic ophthalmitis means. Okay, we are done with the definition. And other two important technical terms which I want to say regarding the definition of sympathetic ophthalmitis is the injured eye, that is the eye which is injured by the penetrating injury, is called as exciting eye, and the fellow eye, the other eye which is present, is called as sympathizing eye. Everyone has to know what exactly is this exciting eye, what exactly is this sympathizing eye regarding when the discussion comes about sympathetic ophthalmitis, because it is very important technical terms. Okay, next we'll study about what is the incidence of the sympathetic ophthalmitis. As I said in the definition, it is a condition following penetrating injury. So penetrating injuries are more in the children, that is, they don't know what exactly it is, the objects or something, or by accident they get a penetrating injury when compared to adults. Yes, so the incidence of this condition is very much higher in children when compared to adults. Okay, next we'll study about the etiopathogenesis of this condition, that is sympathetic ophthalmitis. So, what are the etiological factors? What are the predisposing factors when it comes for sympathetic ophthalmitis? The predisposing factor, as we mentioned, that is the penetrating injury to the eye, the first one. And next, any injury to the ciliary region, which is so called as the dangerous zone of the eye. I'll repeat, the dangerous zone of the eye, that is the ciliary region. If any injury is encountered in this particular region, then it is a predisposing factor for development of this sympathetic ophthalmitis. Okay, and next we'll discuss about the pathogenesis of this topic of sympathetic ophthalmitis. How exactly this disease develops in the eye following a penetrating injury. So there are many postulates, many theories regarding the pathogenesis of sympathetic ophthalmitis. Among all of them, the most widely accepted theory is the allergic theory. What exactly is this allergic theory? Yes, we've got to discuss what exactly it is. That is, here in this theory, it postulates that uveal pigment is considered as an allergen, and this uveal pigment elicits plastic uveitis in the sound eye, so giving rise to this condition of sympathetic ophthalmitis. So the key word over here which you have to mention in the exam is the allergic theory while explaining the pathogenesis of sympathetic ophthalmitis. Okay, now the important thing while discussing this topic, that is the pathology which is involved in sympathetic ophthalmitis. So as I said, it is a bilateral granulomatous panuveitis. Obviously, by understanding these words, the pathology we can guess, that is the nodular aggregation. So as it is a granulomatous condition, the leukocytes, plasma cells, giant cells, epithelioid cells all gets aggregated, forming a nodular structure in the eye. So And the second most important pathological term or pathological feature which is involved in this is Dehlenfurth's nodules. Okay, so these Dehlenfurth's nodules are formed in this case of sympathetic ophthalmitis. And the last pathological thing which is present here is sympathetic perivasculitis. What exactly is this sympathetic perivasculitis? It is a inflammatory condition of the vessels. On visualizing the retinal picture, there is perivascular, that is around the vessels, there will be perivascular infiltration of the inflammatory cells. So giving rise to a condition of sympathetic perivasculitis. Hope everyone has understood till now what exactly is the definition of sympathetic ophthalmitis, incidence, etiopathogenesis, pathology. Now, as an ophthalmologist sitting in the OPD, we should know, we should scrutinize the clinical features, we should understand it completely to diagnose the condition correctly as sympathetic ophthalmitis. Yes. Now we'll study about the clinical features. That is, what are the clinical features which are present in the exciting eye? That is a technical term which means that the injured eye. So, the clinical features in the exciting eye is, one is the acute and the mild case of plastic uveitis will be present, and along with that, the main features are globe tenderness, congestion, that is ciliary congestion, and also there will be other things of dangerous signs, that is keratic precipitates presence in the backside of the cornea will be there. And also another important clinical feature is the lacrimation which is present in the injured eye, that is exciting eye. Next, we will study what exactly is the clinical feature when it comes for sympathizing eye. So, in this sympathizing eye, clinical feature develops after 4 to 8 weeks, that is 4 to 8 weeks of injury to the exciting eye. So, after this, the clinical features develops in the sympathizing eye. But in this clinical features of sympathizing eye, they are broadly divided into the prodromal stage and the fully developed stage. So, in case of prodromal stage, the symptoms which are present in the prodromal stage, as I said, there will be mild uveitis is also present, globe tenderness is also present, and also the signs which are present here is there may be retrolental flare or cells. What exactly this term retrolental flare or cells means? Retrolental, that is lental meaning lens, behind the lens. So inflammatory cell aggregation, just like Brownian movements which are present behind the lens, is called as retrolental flare. And another important sign which is present in case of prodromal stage is, as I said, keratic precipitates which is present in the backside of the cornea. That is an important sign. And other signs like, as you can guess, that is the mild globe tenderness, disc edema, and also lacrimation may be present in the sympathizing eye in the prodromal stage as a clinical feature. So, next coming to the fully developed stage. So, the signs and symptoms in case of fully developed stage, that is fully developed sympathetic ophthalmitis in the sympathizing eye, very much resembles that is acute plastic iridocyclitis, which I said. So, sympathetic ophthalmitis can be also defined as it is a condition which gives, or the way the symptoms and signs are very much similar to the acute plastic iridocyclitis. Okay. After scrutinizing everything about the disease, its incidence, clinical features, pathology, pathogenesis, etc., the important thing as an ophthalmologist, as a doctor, is knowing about the treatment part. So, in this treatment part, first we will speak about the prophylaxis of sympathetic ophthalmitis. So, if we encounter any case of sympathetic ophthalmitis, first, if the wounded eye, that is exciting eye which is injured, has already developed sympathetic ophthalmitis, before it affects the sympathizing eye, excision, that is complete excision, enucleation of the eye should be carried out so that the other eye's helpful vision will be preserved, will be intact. So, but this is carried out only when the injured eye has no hopes of the vision, that is useful vision. But if there is a hope of useful vision, then we have 3 other types of prophylactic things which we can carry out. that is, the first thing is meticulous repair. So we have to use the microsurgical instruments in ophthalmology to clear out the wound, to repair the wound by using the microsurgical instruments. So the important point which we have to keep in mind during doing this meticulous repair is that the uveal incarcination should be checked out once, so that should not aggravate the disease. So the next thing is early expectant treatment. So early expectant treatment includes administration of corticosteroids, which may be systemic, topical, etc. All forms of topicals, corticosteroids plus antibiotics should be administered. So after that, after 2 weeks of this expected treatment, if the uveitis has not come down, if it is not reduced, then again the treatment of choice will be complete excision. So after that, if the treatment, in case if the sympathetic ophthalmitis has already intervened in the eye, that is the surgical treatment, as I said, complete excision of the eye, enucleation of the eye is very much required. In case of conservative treatment, we go for all types of application of corticosteroids, as I said, periocular injection as well as systemic corticosteroids, topical corticosteroids must be administered. So after this, if the case is very much severe, then we have to administer immunosuppressant drugs. And other important treatment part, which is very much important, is administration of atropine drops topically to the eye thrice a day. So these are the conservative ways of management of sympathetic ophthalmitis. So at last, studying about the prognosis. The prognosis may be good if this expectant treatment is carried out immediately after diagnosing the condition in the prodromal stage. If it is diagnosed in the prodromal stage and it is treated, then the useful vision, there may be hopes of getting back the useful vision in that time. If the treatment is started in case of advanced stage, if the treatment is started in fully developed stage, even after giving the best treatment available, the prognosis will be very poor. So this is all about sympathetic ophthalmitis. Okay, so to revise the topic which we have discussed just now, sympathetic ophthalmitis, coming for the definition, it is a bilateral granulomatous panuveitis, which is a severe condition which occurs following a penetrating globe injury. And etiopathogenesis, as I said, predisposing factor, injury to the dangerous zone, that is the ciliary body injury may predispose for development of sympathetic ophthalmitis. Other than that, when it comes to pathogenesis, allergic theory, which I said is a widely accepted postulate for pathogenesis of sympathetic ophthalmitis. So coming to pathology, the important pathological term is the Dolenfurth's nodules, presence of Dolenfurth's nodules. So clinical features, coming to the clinical features, as I said, there will be tenderness, globe tenderness, lacrimation, and also congestion will be present. And coming to the sympathizing eye, there are clinical features are different when it comes for prodromal stage and when it comes for fully developed stage. And coming to the treatment part, as I said, if the sympathetic ophthalmitis has intervened and if there is no hope of getting back the useful vision, then the treatment of choice is surgical complete excision or enucleation of the eye. And if there is hope of getting back the useful vision, and if we are going for conservative therapy, then application of corticosteroids, application of atropine drops thrice a day, and in severe cases, application of immunosuppressant drugs are very much important. So this is all about the topic of sympathetic ophthalmitis. Hope you all people understood what exactly the topic it is. It is a very important topic when it comes for university examination of third professional. So give a separate concentration on this topic and please study this. Thank you one and all.